Hi, I'm Lauren, resident biochemist at the Mineral Body, and today we're going to be having a look at some of the 12 primary biochemic minerals, starting today with mineral number 1, calcium fluoride. So the numbering systems can differ country to country. I am in Australia. Number 1 here is calcium fluoride. So main keywords to remember with calcium fluoride would be elasticity, number 1, and also body coverings. So tissue elasticity, for anywhere in the body where a lack or excess of elasticity is causing issues. So anywhere the tissues have sagged, lost their elasticity, anywhere flabbiness in the body is becoming an issue, calcium fluoride could be involved there. Fallen arches, things like that, loose ligaments. Calcium fluoride can help tighten and tone those tissues back to that more perfect state. So toning tightens what has loosened and softens what has hardened or calcified. Hardened arteries, things like that, calcium fluoride can be beneficial for. Bone spurs, issues with the bones themselves, deformations of the bones like the spurs and lumps. Calcium fluoride, especially in the bone coverings, is hugely impactful. Supports the formation of bones, tendons, ligaments, teeth and nails, imbuing these tissues with properties of hardness and flexibility. So nails are a good example of this. If you have nails that bend too easily or snap too easily, both of these are so they snap too easily, they're too hard. They bend too easily, they're too soft. Calcium fluoride will help you find that happy medium, strong, flexible but not brittle nails. Same with your hair, same with your skin. And this also carries over to the tendons, ligaments, joints, bones and teeth. All of these areas as well, you might notice, are these slower to impact, slower to heal or affect areas. And this is primarily due to the fact that these tissues, the density of circulation is less, so they don't have as much capillaries through them as, say, muscles do. They're also less innervated than muscle tissue. There's less nervous tissue throughout joints, ligaments, bones, that kind of thing. What this means is the nutrient exchange rate is slower in these areas, and so affecting these areas, we must have patience. It's going to be an overtime thing. We can work on them, we just need to be patient. So involved in the maintenance and integrity of the protective body shells and coverings. So calcium fluoride is one of the main preventatives against tooth decay, tooth caries, tooth issues in general, and this is due to the fact that it looks after the enamel, the protective coating of the tooth. And it looks after it in a few different ways. So it builds up the enamel, number 1, it's involved in the enamel itself, but it also tempers the enamel, so it makes sure that the tooth is not too hard and therefore too brittle and prone to snapping, cracking, that kind of thing. It imbues a shock-absorbing quality into both the enamel and the bones. That shock-absorbing quality is very important for the bones as well. So calcium fluoride is found in skin, elastic fiber and tissues such as tendons, ligaments, vascular walls, the periosteum, which is the bone covering, the enamel of teeth, the protective coverings of the body like the fascia. It's needed in a potent form in the brain, the eye lens, the heart, lungs, kidneys, bones, muscles and ligaments. Notes on usage for calcium fluoride. It's a slow-acting agent and it's contained in the body in small amounts. And so because of that, when you're using calcium fluoride, I prefer to use it in the 12x potency, and the DHU tissue salts that I use, calcium fluoride is by standard in the 12x as opposed to the standard 6x potency. So what this means is the standard 6x potency, so the mineral has been taken, grown in its pure crystalline form, so the structure is correct, and then we have ground it down, diluted it with a binding agent through a process called trituration, which is the physical grinding of these perfect crystalline elements. We do this to maintain the perfect form and just fracture it down. fraction it down. The crystal must first be grown in its perfect form to retain the memory of that perfect element. This is why we use this process instead of just dissolving the minerals in water to the correct ratio. This is adding an element of alchemy or spagyrics to the process. It is honouring the most fundamental basis of the mineral, its crystalline shape. That we are preserving. That does mean that this process is quite in-depth and take a lot of time. So to get to a 1x trituration, that's a grinding process of 1 hour, 1 part mineral to 9 parts binder. Grind it down for an hour, and then we've got a 1x trituration. Then we move down to the 2x trituration by adding another 9 parts binder, grinding for another hour. Keep going. Eventually we get to the 6x, which is the standard trituration, the standard potency, and that is roughly 1 part mineral to 1 million parts binding agent. So very diluted, very minuscule. This is why these elements are small enough to just flow into the pores of a cell. Okay, so from the 6x dilution, if we continue along that process 6 more times, we get to the 12x dilution. So we've got minuscule, tiny little particles now, and much more dilute. So we have 1 part mineral to 1 billion parts binding agent. That's what we're working with calcium fluoride, because it is a trace element of the body. We have it in trace amounts, and we use it as a tempering agent. So we're going to supply it in the way that the body would prefer it. Trace amounts over time. Keep in mind that the body is always regenerating. It is always in a state of breaking apart and rebuilding. Constant. Solve et coagula. Constant breakdown and renewal. So the body will break down approximately 10 to the power of 11 cells per day. Roughly over 1 million cells per day are destroyed and renewed. Over 1 million cells per day commit voluntary apoptosis, destroy themselves, and are renewed. And the body is always aiming for perfection. If we start supplying the correct minerals that the body is deficient in, while it's going through this process of destroying 1 million cells per day, it'll begin to remake cells more perfectly once we start supplying the minerals. This is how we begin affecting tissues. This is how we begin affecting and reinitiating processes of the body. It takes discipline and it takes time, but it can be done. And this is amazing. So this should excite. Now, some of the applications for using calcium fluoride, some of the areas in which it will be beneficial. Bone spurs, cartilage, discs and joints, so for the maintenance of cartilage, discs and joints. For calluses or corns, where the tissues have hardened. For caries, tooth caries, again we're looking after the enamel, so that's going to protect against most of the decay, most of the problems. So for dizziness, should that be related to, say, lax circulatory power, the vessels losing their elasticity, that can produce dizziness. Flabbiness anywhere and in general, calcium fluoride is going to help you tighten and tone those tissues. For flat feet or fallen arches, hemorrhoids, any prolapse anywhere in the body, that's a lack of elasticity is part of that. So restoring that elasticity will allow those tissues to restore their shape and hold their shape, helping to prevent this happening. Glands hardening, a lesser known aspect where calcium fluoride can be helpful is if we start to lose elasticity of like the lymphatic vessels, the circulatory vessels, that kind of thing, our ability to throw off exudations and to absorb is impacted. So the fine little hairs on the outside of everything, the cilia, these require elasticity to be able to function and move correctly, and their function dictates our ability to both absorb nutrients and to expel exudations, things we don't want. Lose the elasticity and that inhibits our ability to do that well. Over time you'll see the results of this in the hardening of glands, and this isn't a soft swelling, this is a hardening. It'll feel like a bony nodule, not like a soft swelling of normal glandular kind of engagement. This hardening is the results of these exudations building up and blocking the lymphatic system. So for memory loss, Menopause, supportive for menopause. Osteoporosis, we spoke about that. So it's a component of the bone, but primarily the bone coverings. I think we spoke about that when we spoke about the teeth. So it's to do with influencing the bone's shock-absorbing quality. It tempers the bone, makes sure it's hard enough, especially the outer covering. It's harder than the internal, but also tempered enough that it can absorb shocks. So very supportive of pregnancy. That's a huge one. I'm going to have to do a whole episode just on that in itself. Elasticity and pregnancy, I'm sure you can imagine the relevance. So for prolapses, anywhere in the body, repetitive stress injury, skin elasticity, styes, stretch marks, scar tissue, softens what is hardened, tooth decay, hardens the enamel, for varicose veins, again, patients, and I'd be taking it both internally and applying it externally. Weak ligaments, warts, some of the facial tells for this mineral. So fine cross-hatched wrinkles, starting in here, out to out here. I'd even see the crow's feet happening, but these will be fine dice-like, like cross-hatched wrinkles. And if it's quite chronic, this cross-hatching, so the cross-hatches will get deeper, and the flesh in between the little squares will kind of pucker. And this, if chronic, will lead to an almost elephant skin-like texture. If that elephant was then coated in like a varnish, so it's elephant skin, this shiny varnish kind of coating, that's chronic calcium fluoride deficiency. You might see a reddish-brown colouring to the corner of the eyes, spreading outwards, a reddish-brown. The lips might be cracked or chapped, indicating a lack of elasticity and a split to the tissues, as long as this isn't a fluid issue, in which case it would be sodium chloride. The tongue might be cracked, dry, brown. Brown coating might be visible. But cracked or dry, calcium fluoride is going to help there. The casts, phlegm or sputum, things you might cough up, sneeze out. Signs for calcium fluoride would be lumps, small yellow nodules. Other tells would be enlarged joints. I am an example of. Remember to keep working on. Again, the cream is good here to be applying for the enlarged joints and taking it internally as well. Patience and over time for calcium fluoride, and your body will. The body is also always going to dictate resources according to where it is most necessary. So when you start taking these minerals, your body's going to start prioritizing internal systems, internal organs, and if you're trying to treat something external, like something on an extremity or something in the skin, that's kind of lowest on the body's priority list. If you want to speed up affecting those areas, definitely start applying things topically. If you don't want to buy the creams, just dissolve the tablets externally, topically. But the creams are nicer to use. So I'd be taking it internally and applying it topically should I want to affect something external like skin or joints. Yeah, that's just some advice for speeding that up. Other tells for this mineral include damp, cold, and weather changes would aggravate conditions, whereas warmth and light movement or exercise would soothe all of the conditions, all of the symptoms of calcium fluoride deficiency. And these little differentiating tells here, these preferences, they start to become helpful when you're trying to diagnose which exact mineral you're deficient in. They're just little ways that you can be more certain in your diagnosis. Alrighty, so that's that for calcium fluoride. Actually, one quick note. Beauty tonic. Probably the best beauty tonic you would ever come across would be a combination of calcium fluoride, biochemic mineral number 1, and mineral number 11, silica. So calcium fluoride and silica for wrinkles and for skin health. Calcium fluoride addresses all of the light and fine wrinkles and the skin elasticity, and silica increases the cell's ability to hold water, so how plump the individual cells can be. So that's affecting the wrinkles from inside out. So if we make all of our cells plump and full of water, we're going to be getting rid of all those deeper wrinkles. Calcium fluoride's taking care of all the fine wrinkles and the elasticity. Those two together, beautiful anti-wrinkle treatment. wonderful way to nourish and feed the skin. So yeah, those are some tips and tricks for using biochemic mineral number 1, calcium fluoride. If you enjoyed this little talk, please let us know, leave us a comment, and if you have any questions, likewise, just throw us a comment, and yeah, thank you.